Hello, Dr. Brandt Gibson, and today I'm going to talk to you about the fourth way that you can actually manage peripheral neuropathy symptoms. So as you remember, we talked about nerve re-education, where you're actually teaching the nerve in the brain to communicate correctly again, so you're not getting the malfunction between them that causes non-painful stimuli, for example, to cause pain. And we've talked about the nerve reset, where you're taking it and you're depolarizing and repolarizing the nerve to help it so it functions better again. And then we talked about yesterday nerve repair, where there's multiple things you can do to actually specifically repair the nerve and cause the nerve to function like it's supposed to, because it's now a healthy nerve. So those three are the most common that are used and that are talked about and that people are looking for. The fourth has been around significantly longer, hundreds and hundreds of years, because the Chinese, for example, would use many of these techniques to treat chronic pain or treat nerve type symptoms that we're running into. This is called nerve repression. Now, because it's such an old technique, a lot of times it's not even considered something that we should be doing or should we be treating, and many doctors don't even mention it. Nerve repression is not taking away the symptoms, but giving your body the ability to manage the symptoms in such a way that you can continue to function. Nerve repression can be anything from as simple as saying, okay, mind over body, where you're saying this just doesn't affect me, doesn't interfere with my life, to actually giving you techniques to really get that control. The most common types of nerve repression that are used are acupuncture, which I don't do. I feel like if you're gonna get an acupuncture from someone, you want someone that is very, very skilled at it, very, very well trained, and does it all the time. I do not do that, but it actually has been very effective, for example, at treating certain types of chronic pain, especially peripheral neuropathy type pain. Massage is another very good technique. With a good masseuse, you can actually get really good control of peripheral neuropathy type symptoms. What we have found with our patients is even simple massage of the legs or feet, for example, by a spouse, can actually cause some relief and cause some repression of those symptoms that are causing the limitations, causing the disability or discomfort or distraction that's happening in your life. The one that we use in our practice, in my practice here, that we actually have found very effective as well, is form of meditation, and teaching you the meditation techniques so you can actually get complete control of your body systems, and especially the pain of the symptoms that are happening from peripheral neuropathy. So as you go through this meditation, as you go through this process, you can actually get a repression of those symptoms to allow you to function more normally. So three that we have found to be effective: acupuncture, massage, and meditation. This is Dr. Brandt Gibson, and these are additional techniques that you can use to manage the symptoms of peripheral neuropathy. So this is Neuropathy Nugget day 15. Yes, sorry, I was going to say 14, but 14 was yesterday. This is Neuropathy Nugget day 15. And the goal here is to give you additional ability to manage your peripheral neuropathy. And tomorrow we will start to talk about some of the specific treatments that can be used. So tomorrow we will talk about vitamins and how